We talk a lot about different implant sizes, but what we don't talk about, and is an issue in every patient, is trying to decide what profile implant to use. This is a modern profile, here's a full profile, and here's an extra full profile implant. Now, to really bring home this point, these are the same size. These are all 375. Like, how can that be? This one's so much wider. Yeah, but look, if you look at it in this angle, see, this one sticks out so much further in front of you. And so why do we decide on a flatter one versus a rounder one? Well, sometimes people want a certain look, but also, let's say your width of your chest doesn't have enough room for this implant or this implant, but you want a certain amount of fullness and you have enough skin, then in order to get that bigger size, you have to go with an implant that's rounder so you can fit more in the given width that you have. Sometimes though, someone might have a certain amount of space and wants a really like an extra full profile look, but they don't have enough skin. The skin's too tight. Now, how are you going to stuff something that sticks out that far under the tight skin? You have to be a little bit more conservative in what you put in, just based on how much stretching and how much room there is. So there's really a lot that goes into the decision, but patients are always worried about what cup size or how many cc's. I'm interested in the fit and having the implant fit how wide their chest is, and the different profiles are probably the more important tool in making the fit right.